Hello, welcome to Chapter 7 of the American Healthcare System. I'm Jeremy Whitaker. Now we're going to be talking about different kinds of healthcare providers, and it runs the gamut in this chapter. I'm just going to highlight a few of them, but there are many, many more. So doctors, basically there are kind of two paths to becoming a doctor in the United States. You have your traditional MD medical doctor and your doctor of osteopathic medicine. Then as far as doctors go, they usually fall into two buckets, generalists and specialists. Generalists are usually what you think of as a family doctor, primary care, and then specialists, well, your cardiologist, your, whatever, pediatric, hospital, so a lot of different specialties that a person can have. And then there's this concept of geographic maldistribution and specialty maldistribution. Geographic maldistribution is the fact that doctors tend to be clustered in urban areas. So there maybe isn't a doctor shortage, but you may be far away from a doctor because doctors want to live in cities and get paid more money and be near other doctors. And this is especially true when you talk about specialists and when you talk about mental health providers. In fact, all of the psychiatrists in the state of Iowa, I believe, live in like 5 different counties out of 99. So again, they tend to kind of cluster together, which makes rural healthcare a bit of a challenge. Specialty maldistribution is the fact, and it talks about in the book, how specialists tend to make more money than generalists. And if it takes the same amount of training or a similar amount, why not be a specialist? And this is especially true for doctors with hundreds of thousands of dollars of student loan debt. So again, it may be a necessity that they specialize just so they can pay back the money they owe. Now, filling an important role are the mid-level provider, two that we'll talk about here, the physician's assistant and the nurse practitioner. The book also lists a certified nurse practitioner, but same thing. So nurse practitioners and physician's assistants, different paths to that. Nurse practitioner, you have to be an RN. You usually have your BSN first, and then you go on, and that is a path you can get at the graduate level. A PA, on the other hand, you can have a 4-year degree, usually in the sciences, and then go on to be a PA. Now, different states have different rules. Iowa's pretty strict about how physician's assistants can practice. They have to have a doctor that signs off on some things, where the nurse practitioner has a lot more freedom. But in other states, it looks very different. So other types of providers, nurses are the biggest category of providers. And again, you have all different levels from the LPN, the licensed practical nurse or vocational nurse. It takes about a year of college, all the way up again to, at the high end, you have nurse practitioners, nurse anesthetists, you have midwives, so who have, again, graduate education. But again, most are clustered at the RN and BSN level. And they're the ones, again, who provide the bulk of care. Then other types of professionals talked about in the book, dentists and dental assistants and dental hygienists, who also have a very large role. You have pharmacists and pharmacy techs. You have optometrists, who are different than ophthalmologists, who are doctors. Where optometrists are, again, more of a specialty around day-to-day eye care type things. Psychologists, and some psychologists, like in Iowa, you can have a prescribing psychologist. So again, the line between a psychologist and a psychiatrist starts to be a little bit more blurred. And then podiatrists, of course, who specialize in foot and ankle issues. Some more. You have anesthesiologist assistants who actually make a surprising amount of money, according to the book. Cardiovascular techs, cytotechnologists, which, we were talking about lab specialties. Sonographers, which, of course, we have here at Allen College that we train. EMTs, emergency medical technicians, people in ambulances, who make a surprisingly little amount of money for the work they do. Perfusionists, which is a very interesting career. Transfusion specialists, respiratory therapists, and again, just the tip of the iceberg, but a lot of different specialties that are incredibly necessary that a lot of people just aren't familiar with. So looking at the assignments for chapters 7 and 8, obviously you're going to meet with me for your participation. Now for assignment 7, you're going to write a paper about maldistribution, the geographic maldistribution that we talked about. And then for assignment 8, you're actually going to do one of the activities from the book, activity 8.8-4, pretty self-explanatory, just do it submit it electronically. And then, of course, your midterm examination is in this chapter. So that'll be from October 10th to 14th. You'll have those 5 days to do it. It is 66 questions and 60 points, but all true, false, multiple choice. I don't think you'll need anywhere near the 60 minutes that I've allotted. Thank you for watching and